Could a popular drug used to raise testosterone levels actually cause heart attacks? That's what the headlines say. But is that the whole story? Hormone specialist Dr. Christopher Asandra from the New Male Medical Centers joins us to talk about this controversy because, look, a lot of even my friends who are middle-aged are wondering, should I be supplementing with testosterone? Should I not? What are my risks? Tell us about this in particular, because heart disease, #1 killer of men and women.
So before you start screaming at the headline and saying, oh my gosh, testosterone causes heart attacks, you gotta look at the actual case. It wasn't because the testosterone caused a heart attack, it was more because they fraudulently misrepresented their product overall. This person actually had a history of high blood pressure, hypercholesterolemia, smoker as well on top of that. So, you know, it's really hard.
There were other factors going on.
Absolutely, other factors that were going on.
So I have to ask you, so, you know, I get my testosterone checked. When should you get your boost your testosterone? Do you treat a low normal value?
Yes, no. It really depends on your symptomatology. So if you are starting to suffer from some of those symptoms like low libido, less energy, fatigue, I can't get up in the morning, I work out every day and can't put on that muscle mass I used to, and I can't get rid of that fats, then it's probably time to start considering, you know, getting some blood work done and see.
Sold.
Well, but isn't that...
At what age are people usually starting to look at this?
You know, the studies have shown over the years, since we're in a digital age now, constantly bombarded by stress, high cortisol levels.
Right.
And the more we see it now, we're seeing it in younger and younger men now. I mean, I have guys in their mid-30s that are on it now. Usually it's something you think in their 60s and 70s, but people are getting younger now.
This is a relatively new phenomena that this many men are walking around, and women, with hormone replacement. So I do want people to caution, because hormones, there is a symphony, and you have in hormonal regulation, when you start supplementing, it shuts down some of your own endogenous production. And I think my big thing is, and I think you would agree with me, is you better go talk with someone who knows what they're doing, because there are a lot of people in this field who don't really know what they're doing, and they're going to try to jack your testosterone levels up to 12, 1300, and the more the merrier. So I like that you take an individual approach.
Absolutely, and that's something we always have to play a factor in. Each individual really needs to be looked at as an individual patient before you just substitute this. And then hormones, like you said, is very powerful, and it can really be life-changing for some people in a positive way, but also monitoring the patient's blood work too. This is something that I see a lot of doctors do.
That's a good point.
They set them on autopilot. They put them on these testosterone.
How frequently do you recommend monitoring if someone is on hormone replacement?
I usually say every 2 to 3 months.
I think no matter what treatment you're giving a patient, treating the individual is so very important. Thank you for this.